Nurse TV, brought to you by HESTA and the Australian Nursing Federation.
Well, prostate cancer is the most common male cancer in the community.
I think the common theme, first of all, is fear, just from the word cancer.
We're talking about all aspects of their health. They're a well group, but there are lots of supportive care issues which we need to get involved with.
This is the Prostate Clinic at the Peter MacCallum Cancer Institute in Melbourne. This clinic is different because it is run by nurses, which enables a holistic health service to men with prostate cancer.
So you're feeling tired?
The nurse-led clinic here at Peter Mac is for patients that have got prostate and bladder cancer. They're actually having either 6.5 weeks to 7.5 weeks of radiotherapy, and they actually see a nurse rather than the doctor while they're on treatment.
We may have to put another catheter. And we see them on 3 separate occasions throughout their treatment: week 1, week 4 and week 7.
It has benefits in terms of often the nurses are somewhat more in tune with some of the patient concerns.
My role as a prostate care nurse is to advise patients and be their interim between them and their doctors about feeling free to discuss their problems and issues that concern them on a one-to-one basis.
We spoke about the importance of keeping your fluids up. So
that could be sexual, or it could be just the fact that they're frightened because they're not sure what radiotherapy is. I'm a contact person that works through the system with them so that they're feeling comfortable with me.
So Hank, how have you been?
Oh, since last
Just
time
a
I've
little
seen
bit
you so far, a bit tired.
Well, what's different about it is that probably only see a maximum of, say, 12 patients, so we're able to give the patient 20 minutes to half an hour to consult with them. However, we do have time to also talk to them about other things that might be going into their lives, such as sexual health, fatigue issues, family issues.
Because you can speak to them very much on a one-to-one basis, and you can actually address their individual concerns. So even though you have several men on treatment at once, everyone's an individual, and the nurse-led clinic gives you that opportunity to look after them on their needs, not specifically, generalised needs.
The paradigm of the nurse-led clinic allows the nurses to spend time helping their clients deal with the fear caused by the word cancer.
They hear that and they tend not to hear anything else in their consults, and so sometimes when we're seeing them for the first time on treatment, we go right back into talking about what's expected, some potential side effects that they can expect. I often tell them that they're not going to be radioactive, because a lot of people think that they're going to be radioactive having radiotherapy, and that's a real fear. A fear that they can cause some issues with their partners, so I tell them that it's okay for them to carry out with their sexual function if they had sexual function prior to starting the treatment. And then it really leaves it up to the men whether they want to take that further, that conversation further, or whether they're happy to just, throughout the 7 weeks they will bring it up again. It does come up again.
A nursing research project was conducted by Peter Mac about patient experiences at the nurse-led clinic. The men with prostate cancer were researched over 12 months, and the findings found that almost all men preferred one contact throughout their prostate cancer experience. These findings cemented the idea and beliefs of the nurse-led clinic at Peter Mac, and it is evidence of a hospital going beyond traditions and to put patients first. The nursing research project was published in the Australian Nursing Journal and is also currently being accepted into the European Journal of Cancer Nursing.
As far as the existing clinic goes, the outcomes from that were very, very clear and defined within the research framework, that the patients benefited enormously from seeing nurses, and the best thing they liked about it was seeing one person the whole time, rather than chopping and changing. If I take a caseload of patients on the nurse-led clinic, I see that patient the whole time through the 7 weeks. I'm their contact person, and I can coordinate their care. My colleague Kath, who also carries this clinic out with me, she has a similar caseload. So we get to know our patients really well. That's one of the best benefits, I think. But it's also about being able to help them and get them through this awful period, and that's what we're here for, and to and make that as seamless as possible.
I think I like most about the job is the team that I work with. They're really very supportive, and also just meeting the patients and their families and just going through their journey with them and giving them someone who they feel comfortable with.
Mary and Kate, two nurses making a difference at Peter MacCallum Cancer Institute. Prostate cancer kills approximately 3,000 men every year in Australia. In fact, it kills more people than breast cancer. Prostate cancer is deadly because symptoms often do not present until the cancer is very advanced. Some symptoms that may occur are the need to urinate frequently, especially at night, difficulty starting urination or holding back urine, weak or interrupted flow of urine, painful or burning urination, difficulty in having an erection, painful ejaculation, blood in urine or semen, or frequent pain or stiffness in the lower back, hips or upper thighs. If you have any of these symptoms, please see your doctor as soon as possible.